Oh, Jack, thank goodness it's you.
Hey, Amanda.
Hey, thank God you're here.
Hey.
Wait, what are you doing here?
You know, I'm just admiring the beauty of Tucson and this sculpture.
It is beautiful, isn't it?
It is.
But I've been looking for Neema. I'm trying to give him his phone. He's on call tonight.
I can help you find him.
Really?
Yeah.
Well, that would be awesome. Do you want to help us find him?
Okay, well then.
Perfect.
Where could he be?
Well, you know, there is the CRC over there. That's where we do emergency psychiatry, where we get to treat most acute patients in our second year.
Isn't that standing for Crisis Response Center?
That's it, yeah. And it's one of the unique setups that's only here and in one other state.
Okay, but let's start off at the Behavioral Health Pavilion, right here where we're standing in front of, where there's 245 licensed beds, and it's part of the top 100 hospitals here in the US.
Wait, Jack, how many sunny days are there here in Tucson?
I think there's 265.
Wow, that's almost as many beds as sunny days.
Well, come on, let's get started.
Let's get started.
Wow.
Wow.
Check out this lobby. It's so light.
And airy.
Yeah.
Wow. So where should we start looking for them?
I don't know. Maybe we should start at the courtroom first.
Yeah, we talked about the courtroom, and then maybe next,
We can
maybe
go upstairs and
yeah.
see the inpatient units, perhaps.
That's a
He's
good
probably
idea.
up there.
Yeah. Do you think he could be here?
Maybe, let's see.
Wow, check out this courtroom.
It's so big.
And regal.
You know, this is connected right into our inpatient unit where a lot of our residents get to testify daily.
Yeah, it's true. Usually they get to testify in involuntary court-ordered treatment trials, and it can be really, really helpful for our patients to be adherent to treatment.
Awesome. But you know, I don't think I see Neema around.
Yeah, me neither. I object.
Oh, maybe he's up here. This is where the inpatient units are.
That's right.
Wow, look at this beautiful hallway.
It's so light.
And airy.
Well, where do you think he could be? Could he be out on the patio where we all eat lunch and hang out?
Yeah, look at all these wonderful people enjoying themselves. I don't see him.
I don't see him. Or maybe.
Maybe he's in one of our inpatient units.
That's what I was thinking. He could be on the East unit, which is the more acute
More
patients.
acute, or on the West unit, which is less acute patients.
Yeah, and we do see patients on both units.
Yeah, we get to rotate on both of these units.
Wait a second, I forgot. I could just call him.
Oh my gosh.
Oh my God, okay. Hang on.
It's in psychiatry. No, this isn't Neema. Hi, I'm Magnolia Swanson. I'm one of the first year interns. I'm on my inpatient psychiatry rotation, which is a rotation that a lot of residents look forward to, especially your intern year. You're finally off service. I'm here with 3 other interns and then a second year resident and a 4th year resident. So it's a really collaborative atmosphere where you can turn to your neighbor, and if you have a question about ordering something or starting a titration, it's really easy to discuss it with one of your colleagues. This isn't our only inpatient rotation. We also rotate at the VA, where we're working with veterans as well as active service members, given our proximity to Davis-Monthan Air Force Base. At the VA, we're mostly working with a voluntary population, but here at the South Campus, we're working with a more acute population, both voluntary and involuntary, which means that even as a first-year resident, I've had experience testifying in mental health hearings. Here at South Campus, we have 2 units. Both of them have 33 beds. We were just in the resident room, and across the hall we have the nursing station. And just 2 doors down on the left, we have social work and case managers. And just outside the hall, we have our psychiatric pharmacists. So as you can see, it's really easy to talk to people face to face and to collaborate. And we really do take it as a team-based approach to treatment here at the U of A.
Whoa, where is this?
This is our 3rd floor where we have our outpatient clinic.
Oh, right. This is where most of the 3rd and the 4th years hang out.
Yeah, you know, I think Neema has his big sib up here, Tyler. You know, all throughout the years, there is your big sib who's 1 year ahead of you, who can give you tips and tricks for the next year coming ahead.
Love me some good tips and tricks.
Who doesn't?
Right. Let's go into the lobby and see if he's in there.
Yeah, good idea. Oh my God, what are we gonna do?
I know, 3rd floor is so big. How are we ever gonna find him?
You know what, I'm gonna try calling him again.
Exactly, you have a phone.
Hello? I'm not Neema. I don't know where he is. Hi, my name's Tyler. I'm a 3rd year here. Come on, let me show you around the clinic. Let's go this way first. So this is our break room. And what I hope you're getting a chance to see through the videos downstairs in the inpatient unit or up here in the outpatient clinic is how the residents, the program, and the layouts of the building are all set up to engender a sense of community. Well, see, this is where we like to eat lunch. We've got a roof here, so we're never in the sun. And this is where a lot of 3rd years, sometimes even 1st and 2nd years, like to hang out and eat. But there's a lot more I want to show you. Come on, let's go. One of the great things about our outpatient clinic here is that it functions like a standalone clinic. And 2 things that allow that to happen are these 2 rooms right here. One is our EKG room, and one's our blood draw room. And what this allows us to do is not have to send patients off-site. Takes a couple days to get the EKGs, takes a couple days to get the reads, and here I get it instantaneously. There's no delay in meds, and I love it. But our offices are around the corner that I want to show you. So this whole wing is just 3rd year outpatient offices. And I gotta be honest, I love it. There's nothing more fun in my day than cracking my door open when I'm done with a patient, walking the hallway, see which other residents have their doors cracked open, be able to hang with them, share a laugh. There's no better way to work through your day. We've got the offices here, but we also have them set up in the pod style here. Again, just engendering that sense of community that I hope is coming across. But now we're gonna take a look at what one of your offices could look like. And look at this. Look at how spacious this is. And this, if you're here and a 3rd year, would be just yours the whole year. We'll see the amazing view here. And with all this room, you can have the families come in, you can have, the partners come in for couples therapy, whatever you need, you're able to get it done here. It's amazing. But there's more stuff that I want to show you. Because as a 3rd year, you're gonna have 4 supervisors. You're gonna have 2 for medication management, and you're gonna have 2 for therapy. What this allows us to do is be able to teach you all about cognitive behavioral therapy, acceptance and commitment therapy, psychodynamic psychotherapy. You name it, you get to learn from the masters here. And one of the ways that we get to do that is what's coming up behind me. It's the one-way screen room. This is where the residents gather on one side, where there's a one-way screen where the patient and the psychiatrist can't see you, and we're able to see how the masters work. We're able to critique them, we're able to see what they did well, we're able to talk about it afterwards so that we're able to integrate it into how we practice. And that's what this room is. We'll see this is where we all like to sit, and then I don't know what's going on in there, but that's usually where the psychiatrist and the patient sits, and we all get to sit here and watch and hopefully integrate that into our own experience. There's a couple other things that I want to show you though. Around this corner is where the big group room is. As an intern, you're going to spend 1 hour a week for 2 months in this big room here. It's the best way to get to know the interns that you're working with, that you'll be with for the next 4 years, in a crash course style. You get to learn more about them in 8 weeks than you could imagine. But the last thing that we won't be able to see today is around the corner behind me. It's a neurotherapeutic suite where they do ECT, they do TMS, and hopefully one day esketamine. And that's it for our outpatient tour. Thanks for joining us.
Wait, do you think he's behind this, the education suite?
Oh yeah, this is where our program director,
Associate program director,
program coordinator,
med student coordinators.
and all the inpatient attendings sit.
Wow.
He could be in here, but that wouldn't really make any sense, would it? But luckily, it's right next to our inpatient unit, so we can access them anytime we want.
So convenient.
So convenient.
Love it.
Hello? I don't even know who Neema is. Hey, I'm Jen Tran, and I'm a child and adolescent psychiatry fellow here. I graduated from adult residency and decided to stay on for my fellowship. At this clinic, we offer psychiatric assessments, psychotherapy, functional behavioral analysis, as well as a lot of other kinds of treatments. In addition to child and adolescent psychiatry fellowships, we also have geriatrics, addictions, and forensics. Let's go look for who Neema is. This is our group and playroom. Hey, what are you guys doing here?
Have you seen Jack? I don't know where he is. Wait, I think I hear some music. He's probably over here. Let's get inside this call room.
Well, hello.
What are you doing in here?
Oh, it's been so long looking for Neema. I just thought I'd take some wellness time.
Yeah, I understand. Do you want to come check out our room here?
Yeah,
It's a
I
call
mean,
room.
check this out. We have a bed, we have a computer system so you can charge, and also we have a TV.
A little TV, yeah.
How
it's-
awesome is that?
I mean, if you're gonna be on call, may as well be on call in style, right?
You know what I'm saying?
Yeah, absolutely.
Speaking of wellness, did you know we get up to 10 wellness days currently?
Oh my
on
goodness.
top of our vacation days.
Yeah, and we have Cultivating Health and Medicine, a program that Banner set up for us doctors to get together and spend money to enjoy each other's company and build our teams.
I love that. What was your favorite wellness event?
I think I really liked going to Dave & Buster's with my coworkers and playing some air hockey. How about you?
Ooh, I love the plant wellness.
Oh, that was fun.
And I think our GME also offers counseling and psychiatrists who are separate from the program.
That's true. So that way you can tell them about what's going on in your life without worrying about it going back to the program.
Exactly. But anyways, let's get back to looking for Neema.
I guess so.
Mm-hmm.
Oh my God. Well, Neema or not, I'm gonna need a snack.
Yeah, I need some coffee. I don't know about you guys.
Well, let's check out the physician's lounge. I mean, that's the last place he could be.
Did someone say Neema?
Yeah. Oh
Hey
my
guys.
God, Neema. Oh,
How's
thank
it going?
goodness. We've been looking for you everywhere.
Oh, really?
Yeah. Do you want to meet our friends?
Oh, okay, sure. Oh, hey there. How's it going? My name's Neema. This is where we do consults. We take consults from our colleagues in the ED, on the internal medicine and family medicine services here. We work with psychology, social work, and our fellow colleagues, as well as medical students in this room. I'd like to show you around a little bit. Hey there. So here's where some of the residents get together, relax, and like I said, grab a quick snack. We have a refrigerator that's usually fully stocked full of snacks, yogurt, juices, Uncrustables, guacamole, you name it. Also, we have over here a Keurig machine where you can grab some tea or coffee, and a refrigerator over here where you can grab some soft drinks, assorted soft drinks over here. And yeah, I might just fancy a tea or a coffee later.
Well,
Oh,
Neema,
hey.
now that I've found you, here's your phone for call tonight.
Oh, but I'm not on call tonight.
Wait,
Yeah,
wait, there's more than one Neema in this program, isn't there?
yeah, it's one of the other ones
Oh
probably.
my God, so this whole time? Well,
Yeah, well,
thank you.
you're welcome.
It's been a pleasure.
Well, looks like we didn't find the right Neema after all, but I hope you guys enjoy your adventure with us.
Yeah, it's been a really fun tour, and thanks for joining us. And don't forget to visit our website. Well, take care and stay safe.